Medical abortion or medication abortion is the use of prescribed drugs to end a pregnancy. In Australia, a medical abortion can be performed from about 5 weeks up to 9 weeks of pregnancy. It is safe and legal, and it is more than 99% effective. If someone is more than 9 weeks pregnant, they may need to consider a surgical abortion. A surgical abortion is a surgical procedure whilst under a general anaesthetic. Talk to a doctor or nurse for more information about surgical abortion. However, if you decide to have a medical abortion, a doctor or nurse will discuss pregnancy options and talk to you about where and when to have a blood test and an ultrasound. The ultrasound is important because it checks the stage of the pregnancy. This is most accurate if it is done by inserting a small scanner into the vagina. Sometimes this is done by scanning the abdomen. Some people prefer not to see the ultrasound. Just let the medical professional know if you don't want to. Blood tests check the pregnancy hormone levels before and after the abortion to check if the abortion has worked. When you visit the doctor or nurse, they will discuss how and when to take the 2 medications involved in a medical abortion and what to expect during the abortion. There are 2 medications prescribed called mifepristone and misoprostol. Most doctors will also prescribe anti-nausea and pain medication. The first medication, mifepristone, works by blocking the hormone progesterone, which stops the pregnancy from developing. At this point, most people can go about their usual activities but may experience some spotting or start to have some bleeding. Then 36 to 48 hours later, the second medication called misoprostol is taken. Misoprostol causes the cramping and bleeding that empties the uterus. For most people, the abortion can take about 2 to 6 hours. It is normal to have lots of cramping and bleeding and to pass clots and tissue. A medical abortion is usually heavier and more painful than a normal period. People may also have an upset stomach, diarrhea, dizziness, or a mild fever. In most cases, people are given an anti-nausea medication as well as pain medication. For cramps, it can be helpful to have a hot shower, use a heat pack, and take the stronger pain relief medication given by the doctor. Written instructions are given to take home and the number for a telephone advice line that is staffed by nurses 24 hours, 7 days a week. It is recommended to rest somewhere that feels safe and comfortable and where there is a bathroom nearby. It is important to have an adult support person with you throughout the process, in the rare case that people may need to seek medical help. Symptoms usually settle once the pregnancy has passed. It may take up to 24 hours to be finished. Following the abortion, you may feel like taking 1 to 2 days off work to rest. A couple of days after, the doctor or nurse will call to answer any questions or concerns. It is normal to have period-like bleeding for 5 days, then bleed lightly for up to 10 days to 4 weeks after. After taking the first tablet, it is important to have a blood test to check that the pregnancy hormone level has dropped. A couple of weeks later, there is a follow-up appointment. How people feel after an abortion may depend on the reasons for having it and how they feel about the decision. Many people feel relieved that they have made the decision that is right for them at the time. If further emotional support is needed or wanted, it can be helpful to let the doctor or nurse know. There are also specific pregnancy options counsellors available pre- or post-abortion. The cost for a medical abortion can vary depending on age, Medicare card or private health cover, domestic or international student. Please contact Family Planning Victoria for more information.